If someone has malaria, what do we say? We say go to the hospital. If someone has hypertension, we say go get treatment. But when someone is struggling with depression or addiction, we go silent, or worse, we judge. And that is the problem. That is where stigma starts. So let's break it down. Stigma is a mark of shame or disgrace attached to a person or condition. So to destigmatize means removing that shame. And so today we are learning how to remove the shame attached to mental illness and substance use. Welcome back to Mindful Peace with Dr. Antonia. I am a doctor of nursing practice with specialty in psychiatry and mental health and an expert in peace and conflict resolution. So, what is mental health? Mental health is not just the absence of illness, it includes how we think, how we feel, and how we relate to others. But in many communities, mental illness is often misunderstood. People say it's spiritual attack, it's weakness, you are not praying enough. But research tells us something different. Mental illnesses are medical conditions involving changes in brain function, emotions, and behavior. Let's make this real. Depression is persistent sadness, loss of interest. Anxiety is constant fear and worry. Bipolar disorder is extreme mood swings. Schizophrenia is hallucinations and disorganized thinking. And substance use disorder is chronic brain disease involving addiction. These are just a few examples of mental illness disorders. These are not character flaws, they are treatable conditions. Now let's talk reality. Many people may experience mental illness in their lifetime, yet many never seek help. And why is this? Why do you think people don't seek help? It's because of stigma. Instead of treatment, you hear people say, it's your village people, it's spiritual, it's punishment. Listen, untreated mental illness can lead to poor quality of life, job loss, substance misuse, even ending one's life. This is not just a health issue, it is a public health crisis. Stigma is one of the biggest barriers to care. There are three main types of stigma. We have social stigma. This is how society views mental illness. We have self-stigma, when an individual feels ashamed. And we have structural stigma, which is lack of services and policies. And let me give you a real example. A person once hid his schizophrenia diagnosis for years, not because he didn't want help, but because he was afraid of being labeled. And words matter. When people say, he's mad, she's weak, just pray about it. Those words don't heal, they harm. They stop people from seeking life-saving care. Let's talk about substance use disorder. Addiction is not a moral failure. It is a brain disease. Substance use disorder is not a lack of willpower. It is a medical condition that affects the brain and behavior. It occurs when the repeated use of substances begins to take control of a person's life, impacting their health, relationships, and daily functioning. And examples of commonly misused substances include alcohol, cannabis, prescription medications like tramadol and codeine. There's tobacco, nicotine, and stimulants, cocaine, and so on and so forth. Many people turn to these substances as a way to cope with stress trauma, depression, or anxiety and life challenges. What may start as temporary relief can quickly become a circle of dependence. But here's the truth: recovery is possible, treatment works, and help is available. So instead of judgment, people need understanding, support, and access to care. Because behind every addiction is a human being who deserves healing and not shame. In the United States, awareness has improved. People now take mental health days. This is a day where you just dedicate to just relaxing and staying away from stress. People now seek therapy and people talk openly. But stigma still exists, even in professional settings. So, how do we break the stigma? How do we fix this? We can fix this through education, awareness, which reduces stigma. We can use respectful language. We can say a person living with mental illness and not an insane person. We can encourage. We can use professional. We can encourage professional help. We can use faith and medicine, and all this can work together. And let me give you a story of a young man. A young man lost his job. He became depressed. Instead of support, the people around him started saying, "Be strong, pray more, fast." But no treatment was recommended. So he turned to alcohol. Then from alcohol, he began to use stronger substances. But one day he got help. And today he's recovered. And now he helps others. That's the power of early intervention. Mental health conditions are real. Substance use disorders are treatable. And stigma is preventable. So today, I leave you with this. Check on someone. Speak without judgment. Encourage help. Let's replace silence with understanding and stigma with compassion. As we close, remember, mental illness is not weakness. Please don't forget. Mental illness is not weakness. Addiction is not failure. They are health conditions that deserve care. Let me borrow these powerful words. This is the time to turn words into action and ambition into impact. Together, we can break the silence and build a healthier world. Don't forget to like, comment, and subscribe to my channel, Mindful Peace with Dr. Antonia. Until next time, remain mindful, remain peaceful, and see you in my next video.